Hello, Dr. Stephen Tugbiyele here, urogynecologist, and in this video we're going to be talking about the well woman exam. This is a very important exam that women undergo either once a year or every other year in order to stay healthy. And as a pelvic floor specialist and a women's health specialist, this is an exam that is very important that we perform on patients. And I like to kind of go through some of the things that I discuss with my patients when it comes to a well woman exam, and let's go ahead and get started. And so I've developed a kind of a head-to-toe approach when I talk to my patients about staying healthy, whether it's a woman in her early 20s, a woman in her childbearing years, a woman in her, as she approaches menopause, in her 40s, and women in their 50s, 60s, and beyond who are in menopause. It's a procedure, or excuse me, it's a office visit that involves us evaluating your history, getting to the bottom of any conditions you may be experiencing with regards to your GYN health and arriving at solutions for those problems. In terms of how I typically start kind of a brain, mental health, social, emotional health kind of approach. And so in terms of brain health, I like to tell my patients to stay healthy in terms of, a lot of my patients are working, so they're using their brains, they're working and doing things that either in the home or out of the home, and supporting that with omega-3 supplements is very, very important, because that is very important for brain health, but also emotional health, more than just brain health and staying physically active and staying healthy is staying connected socially, getting sunlight, getting enough sleep, reducing stress, drinking enough water, staying connected with family and friends, and just managing life is very, very important for brain, emotional, mental health, and wellness. Having good social connections is very important. Being mindful about and being very mindful about other factors that can cause stress is very, very important for mental health and wellness. And then in terms of breast care, I typically talk to my patients about the importance of self-breast exams, performing that once a month in a woman who's having periods. It's typically done at the end of the period when the breasts are less tender. For a woman who no longer has period, I typically tell my patients to start at a particular time of the month and just do it regularly, whether it's at the beginning, the end, the middle, or pick a day. As long as it's regularly done, clinical self-breast exam, or actually I should say a self-breast exam. A clinical self-breast exam is done by a health professional, but if you're performing on yourself, then it's a self-breast exam. Starting in the clavicle and the bone area here in the armpit, and then working towards the nipple on both sides, and doing that regularly is very important. If a woman is to notice any abnormalities, she'll be the first one to notice, and then that could be brought to the attention of their healthcare provider. So breast health is very important. I talk to my patients about bone health, staying strong, weight-bearing exercises, staying physically fit, supporting bone health with calcium and vitamin D is also very important. Bowel health, I talk to my patients about eating healthy, of course, fruits, vegetables, and a probiotic is also very, very good for bowel health. In terms of cervix, kind of going down in that stepwise fashion, performing pap smears in women who still have a uterus. The recommended time to start pap smears is at the age of 21 or 3 years after a woman becomes sexually active, if she becomes sexually active as a teenager. And so doing regular pap smears is very, very important. And keeping up with that schedule is important. I talk to my patients about staying healthy, being mindful of things that can increase the risk of sexually transmitted infections, which can then cause abnormal pap smears in the future, especially if there's an exposure to the HPV virus. So that's very, very important in terms of cervix and the health of that. And then I also talk to my patients about colonic health, especially if a woman is above the age of 45 to 50, getting a colonoscopy is part of that routine wellness recommendation, and to help to screen for colon cancer, and that's very important. Pelvic floor muscle health is very, very important. I typically say 100 Kegels a day keeps the urogynecologist away, and so doing Kegel exercises or pelvic floor muscle exercises is very, very important, because before a woman has a child, it helps to maintain her pelvic floor health. After she's started her family, it helps to maintain pelvic floor health, strength, and tone, as well as afterwards and beyond, to help to reduce the risk or minimize incontinence, accidental urine leakage, or accidental stool leakage, or prolapse. And there are many videos on those conditions that I've already performed, and you can watch those. But one of the paramount ways to help to prevent and maintain pelvic floor health is doing regular Kegel or pelvic floor exercises. It's the muscles that a woman would squeeze to stop the flow of urine or stop gas from coming out unwantedly, and those are the muscles that would be recruited to help to maintain pelvic floor health. And then contraception, that's something that we talk about thoroughly in the office for women who would desire that. There are hormonal, non-hormonal, barrier methods. There are methods that can be used every day. There are methods that don't require to be taken every day, and there's so many methods and their effectiveness rates. So that's something that we talk about. And then we also talk about hormones. Hormones are very, very important in a woman who is especially postmenopausal. We talk about hormonal health and how that can be improved on. There are patients who choose to use natural options for vaginal health, for example, or vaginal dryness or painful intercourse, because that can become common in a woman who is beyond the age of menopause. So something as natural as coconut oil or almond oil can be used for vaginal health lubrication during intimate times and during times that are not intimate, just for comfort. Some patients, however, may choose an estrogen cream or a estrogen that's delivered through a ring or a tablet, assuming there are no contraindications in a woman's history, that can be used to help to maintain pelvic floor health. So there are a lot of things that we talk about with regards to a well woman exam, as you can imagine, as you've heard. And so we tell women not to delay seeing their healthcare providers. A lot of women had to do that recently because of what's been going on in the world the last year or two. And so we emphasize that it's important for women to seek their gynecologist to undergo their well woman exam. For women who choose to see us here in the Metro Atlanta area, you can reach my practice, my personal practice website. My personal website is www.drstephentugbiyele.com. So that's Dr. Dr. Stephen with a PH, Tugbiyele.com. And my office number is 470-325-1280. I can be reached also through my website, my practice website, which is Northside Center for Urogyn.com. And I have a YouTube channel, as you are watching, Dr. Tugbiyele.com. So just wanted to just a quick video about the well woman exam, the importance of, and we tell women they don't have to live or put up with any symptoms they may be experiencing. The time to talk about it is now, and to seek care. And so we're here, and I'm here to help my patients have a better quality of life. Thank you for watching, and until the next video, take care.